I've now worked 2 weeks as an emergency medicine PA. I've got a lot of questions asking, how's it working as a new grad PA, especially in the ER? To be honest, my first couple shifts, I was pretty terrified. The ER group that I'm working with is doing a great job in preparing me and mentoring me. During my first shift, I had some thoughts of imposter syndrome, but then I remembered my training, my experience, and then the team that has my back. I worked as an ER tech for 2.5 years before PA school, so I understand and I know the atmosphere of the emergency department. But working as the ER provider, as the certified PA, it's all on me. When you graduate PA school and you take the pants, you have all this knowledge in your brain. And I think for me as a new grad going into work, you want to help every single person you care for and figure out what's wrong with them. I remind myself that my job as a PA in the emergency department is to rule out any emergencies that are going on with the patient. After I took the pants or the PA boards, I had 3 months off before I started work. So what I did to best prepare myself was review patient cases using the Full Code app. I listened to the MRAP podcast, and then I reviewed Tintinelli's emergency manual. Those are a few things that I did to help prepare myself for working in the ER. The reason I chose this PA job coming out of PA school was because of the training I knew that I would receive. So all of you PA students and new grad PAs that are doing interviews, really ask the companies that you're interviewing with about their training program. Ask them if someone's going to be mentoring you, or if they have a training program, or who's going to be overseeing me when I'm seeing patients. So my job is a 6-month mentorship. During the first 2 months, I'm with an experienced PA. So what I do, I sign up for patients, I go see them, I do the history, physical, and then I put all the orders in. I'm responsible for the patient's chart, updating the patient on their results, doing consults, talking to the hospitalist, admitting patients, all that stuff. When I start a shift and there's patients that need to be seen, I sign up for them. I go see them, I get the HPI, I do the physical exam, and then I come back to my computer and I put the orders in and I start the chart. And while I'm doing that, I give about a 30-second to 1-minute presentation to the experienced PA that I'm working with. So I give them an idea of what's going on, and they'll give me tips and pointers and advice if needed, and then they'll go see the patient as well. Also, a big tip that I learned is that when you're going back to your desk, you're most likely going to be passing the ER nurse taking care of that patient. Just tell the nurse, hey, we're going to be doing this, this, and this, and we'll go from there. Nurses really appreciate that when you update them on what you're going to do for the patient. The PA that I'm working with, when they have time, they go see the patient that I saw, and they'll verify what I told them, and then see if there's anything else that I missed. I've gotten a lot of great and positive feedback so far from the PAs that I've worked with and staff, so that's all good news. I would say the biggest learning curve as a new grad PA is adjusting to the EHR, the electronic health record. Being able to keep up with your charting, it's really hard to do. In just 2 weeks of working, I've become more efficient every day in my charting. So you have to show yourself some grace. It just takes time to learn all these things. PA school teaches you the basics of a chart, SOAP, subjective, objective, assessment, and plan, but the EHR is a whole different ballgame. Efficiency with the EHR will just come with time. The next thing is the efficiency of seeing multiple patients, handling the orders and the notes at the same time. I would say now that's my biggest challenge, is juggling all these patients at one time. So as a new grad PA, take what you can handle, but also challenge yourself at the same time. Honestly, as a new grad, the more shifts that you work, the more comfortable that you're going to get. But the key is, wherever you're working, you have to have good leadership in the group, good mentorship, and good oversight in teaching. I personally think as a new grad, that's the best environment to be in. It gives me the comfort knowing that I'm working with an experienced PA, and then I have ER doctors as well sitting right behind me. Once you start work as a PA, it's so worth it. To hear the words come out of a patient's mouth, thank you. Thank you for helping me with my pain. Thank you for giving me direction. Thank you for helping me figure this out. Thank you for listening to me. That's why we chose to go into this field. Know that you're going to have good days and you're going to have bad days, but remember why you went into it in the first place. Stay tuned for more videos on what my experience is like working as a new grad PA in the ER. I still haven't gotten my first paycheck yet. That's coming up in a few short weeks, but I'm looking forward to it.